Hello everyone. Welcome back to SurgicalUtopia. In the last video we discussed apicoectomy, with its definition, indication and contraindications. Today we will continue with same topic, and talk about the steps and complications of apicoectomy. So let's begin. Steps of apicoectomy. In the process of apicoectomy, there are multiple steps to be followed to reach to the root tip. Flap elevation, retraction of the gingiva or tissue, to gain access to the periordicular area is required. A localized flap design should be given, to access the periordicular bone region of the tooth, to be treated. A vertical incision should be given apical, to the junction of horizontal and vertical incision and elevate the flap. Bone removal. The root tips are covered by bone. On the buccal surface, removal of bone helps in gaining access to the periordicular area of the tooth. There are certain tips which should be kept in mind before going for bone removal. Always use a sharp and sterile round burr. Only light pressure should be given while cutting bone. Shaving or brushing strokes should be given while cutting the bone. Make sure that there are no important structures which are being harmed while bone cutting. Root end resection/preparation. Root resection has to be planned, depending on the anatomical variations of the root structure, and the pulp chamber as well. There can be many anatomical changes in the pulp structure, based on which the length of root to be removed is decided, and also the amount of bevel, which should be given. What are the instruments used for root end resection and apicectomy? High-speed hound piece, with a surgical fissure burr, round burr, and according to a study by Netterman et al., a low-speed tissue burr produced a smooth root surface, in comparison to round burr, which was rough and gouging of the root surface was seen. Some studies have also shown that use of ER.YAG laser and HO-YAG laser was found to produce a much smoother and clean root end. What is the extent of resection required? The amount of root surface to be removed is decided based on two simple points: removal of complete granulation tissue, to remove foci of infection, and to eliminate any anatomical variations of the root structure, and pulp chamber to prevent reinfection. Step-by-step surgical procedure of apicoectomy. 1. Design of mucoperiosteel flap. 2. Reflection of mucoperiosteel flap. 3. Exposure of preapical pathology and root tip. 4. Removal of preapical pathology. 5. Resection of root apex, apical 1/3 road. 6. Sealing of the apex. 7. Toilet of the wound. 8. Smoothing of the sharp bony margins. 9. Bleeding control. 10. Closure of the surgical wound, suturing. Postoperative instructions, medication and care. Complications of apicoectomy. 1. Infection flare-up. 2. Cellulitis. 3. Ludwig's angina. 4. Fracture of maxilla and mandible. 5. Soft tissue injury. 6. Opening of maxillary sinus, or ventral fistula. 7. Secondary hemorrhage. 8. Non-vitality of adjacent teeth. 9. Nerve injury. 10. Luxation of adjacent teeth. So yes fellas, here we come to the end of the topic. Hope you like the video. Until we meet next in another video. Bye bye. And take care.